How to discuss reproductive cancer symptoms with doctors. Talking about symptoms of reproductive cancers like testicular or cervical cancer can feel intimidating, but it is a vital step toward early detection and effective care. The key is to prepare and communicate clearly. Start by keeping a detailed symptoms diary before your appointment. Write down any unusual signs such as lumps, swelling, pain, bleeding, or discharge. Note how often these occur, how severe they are, and how long they last. This organized information helps your doctor understand your situation better. Also, list any questions or worries you have about your symptoms or risks. Knowing your family history of reproductive cancers can also be helpful, as it may influence your screening needs. When you see your doctor, be honest and specific about what you're experiencing. For example, if you notice bleeding between periods or after sex, mention it clearly. For testicular cancer, report any lumps, swelling, or discomfort in the testicles, even if they seem minor. Describe if symptoms are new, worsening, or sticking around for more than a few weeks, since persistent symptoms often need further investigation. It's okay to share your concerns about cancer openly. This can encourage your doctor to take your symptoms seriously and consider appropriate tests. Ask about screening options like pelvic exams, ultrasounds, or blood tests, such as Ca1-54 ovarian cancer. Bringing a trusted friend or family member can help you remember details and provide emotional support. Understanding your doctor's approach is also important. They may perform a physical exam to look for abnormalities, but remember that a normal exam doesn't always rule out early-stage cancer. If your symptoms are concerning, your doctor should refer you promptly to a specialist for further tests or evaluations. Clarify what signs you should watch for and when to return if symptoms change or worsen. Use simple language when describing your symptoms, like, "I have had bleeding after sex twice in the last month," or "I found a lump in my testicle that hasn't gone away." Don't downplay or delay reporting symptoms because of embarrassment or fear. Early detection can significantly improve treatment outcomes. If you don't understand something your doctor says, ask for clarification or written information. For reproductive cancers, specific symptoms to watch for include abnormal vaginal bleeding, especially after menopause or between periods, unusual vaginal discharge, pelvic pain, or heaviness. For testicular cancer, painless lumps or swelling are common early signs. Ovarian and other reproductive cancers may cause persistent bloating, pelvic or abdominal pain, urinary urgency, or changes in bowel habits. If these symptoms last more than a few weeks, it's important to discuss them with your healthcare provider. Remember, each person's experience is unique, and symptoms can vary widely. Always seek personalized medical advice and never relying solely on self-diagnosis. By preparing well, communicating openly, and advocating for yourself, you help your healthcare team recognize potential issues early and guide you toward timely diagnosis and treatment.